So, good morning. Failure will never overtake me if my determination to succeed is strong enough. This is one of the famous quote, and I'm getting inspired by this. So, we are going on to the second topic. That is topic is Mycobacterium tuberculosis, which is another important essay or a short note in the terms of microbiology aspect. So, coming to the minimum contents of today's class. So, the minimum contents will include introduction, classification, Mycobacterium tuberculosis, and the Mycobacterium tuberculosis will be reading about extensively. That is the morphology, culture, resistance, biochemical reaction, antigenic structure, pathogenesis, tuberculin test, laboratory diagnosis, prophylaxis, and treatment. So, coming to that of the Mycobacterium tuberculosis in detail. In Mycobacterium tuberculosis, we will read about the introduction. That is, it is a slender bacilli which is difficult to stain, resists decolorization with dilute mineral acid, and thus are acid-fast bacilli, and they are aerobic, non-motile, non-capsulated, and non-sporing, and they are usually which grow slowly. Coming to the classification, so the classification is divided into two, that is cultivatable and non-cultivatable. So the cultivatable will be tubercle bacilli, atypical mycobacterium which causes skin ulcer, and the saprophytic type of mycobacteria, and the non-cultivatable will be Mycobacterium leprae. Coming under tubercle bacilli, which is a human type. The human type will be M. tuberculosis, while the bovine type is M. bovis, and the African type is M. africanum. And the atypical mycobacteria will include photochromogen, non-photochromogen, and the rapid growers. And the mycobacterium causing skin ulcer will include M. ulcerani and M. bellani, and also the saprophytic mycobacteria will include M. feli. Coming to the morphological characteristics. So the morphological characteristics will include it's a slender, straight, slightly curved bacillus with rounded ends. Occur single or in pairs or in clumps and measure approximately 1 to 4 micrometer in length and also 0.2 to 0.8 micrometer in that of the breadth. So the bacillus are acid fast, non-sporing, non-capsulated, non-motile, and as they are special type of bacteria that is having a mycolic acid coating, that is a waxy coating around that of the cell membrane, they can be only stained with the help of a Z nail cell stain, and it is used to study the morphology. Thus tubercle bacilli stain red, while the other organisms, that is the pus cells, will be stained blue in the background. So they are observed as beaded forms in that of the Mycobacterium tuberculosis. Thus they are gram positive, but it is difficult to stain them with gram staining. Coming to the cultural characteristics, Mycobacterium tuberculosis are actually obligate aerobes, and Mycobacterium bovis is microaerophilic in nature. The colony grows slowly and appears within 2 to 6 weeks, and the optimum temperature is approximately 37 degrees Celsius, and the optimum pH is 6.4 to 7.0. The tubercle bacilli grows easily on the LJ medium, that is a Lowenstein-Jensen medium, and it's an important MCQ. Coming on to the Lowenstein-Jensen medium. The Lowenstein-Jensen medium consists of some five stuffs. That is, the first one is the beaten eggs, the second one is aspergine, the third one is mineral salts, the fourth one is malachite green, and the fifth one is glycerol. So the beaten eggs will be acting as a solidifying agent, and the malachite green inhibits the other organism and accepts and also helps in the growth of only M. tuberculosis. And also, as this malachite green, as the name says, it's green in color, so it provides the color to that of the medium. Coming to the glycerol also helps in the growth of Mycobacterium tuberculosis. So the colonies are dry, rough, buff colored, and they are raised with a wrinkled surface, and it's not easily emulsified with a luxuriant growth, that is, it's a eugenic growth. Coming to the resistance, as each organism shows some amount of resistance, even Mycobacteria is killed at 60 degrees Celsius with 15 to 20 minutes. And they are sensitive to UV light and sunlight when exposed for approximately 2 to 4 hours. They are resistant to disinfectants and can survive at 5% phenol, 4% NaOH, and etc. They get destroyed in a tincture of iodine in 5 minutes and 80% ethanol in 2 to 10 minutes. Coming on to that of the biochemical reaction. The biochemical reactions, that is, it is niacin and nitrate reduction, that is positive in nature. The antigenic structure. The antigenic structure is actually divided into two, that is the cell wall antigens and the cell membrane. So the cell wall antigen will include that of the 4 layers. The first one is mycosites, which is made up of peptidoglycolipids and is the outermost layer of that of the cell wall. Second layer will include mycolic acid layer, that is the principal constituent of cell wall, and the third layer will include the arabinogalactan layer, which is external to that of the peptidoglycan layer, and the peptidoglycan layer is actually maintains the shape and rigidity. So coming to some of the important points of this page. So the introduction would include that it's a slender acid-fast bacilli and it is difficult to stain. The classification would be it's cultivatable, that is the four types, that is the tubercle bacilli, the atypical mycobacteria, the mycobacterium causing skin ulcer and the saprophytic type, and the non-cultivatable type, that is Mycobacterium leprae. Coming to the morphology, the main points are its slender, slightly curved, beaded appearance with a blue background of pus cells, and it's single or occur in pairs. So coming to the cultural characteristics, the cultural characteristics is the temperature is 37 degrees Celsius, the pH is 6.4 to 7.2, and LJ, that is the Lowenstein-Jensen medium, with the 5 contents of it is an important MCQ. Coming to the resistance is seen at 60 degrees Celsius at 15 to 20 minutes when the organism is killed at this temperature. Coming to the biochemical reaction, it is niacin and nitrate reduction, that is, it is positive for that. Coming last to the antigenic structure, it is divided into cell wall antigen, there is the 4 layers, and the cell membrane. Coming to the next page, that is, we have the pathogenesis. So the pathogenesis of tuberculosis is divided into 2, that is the pulmonary and the extrapulmonary. The infection spread through that of the cough droplets from the affected individual. The tubercle bacilli is engulfed by macrophage, and what happens is, the bacilli will also survive in that and multiply in the macrophage. So they lyse the host cell finally and infect the other macrophages and gets disseminated to the other parts of the body, including the lungs. So the cell-mediated immunity. So the cell-mediated immunity, that is the CMI, plays a major role to interact with those macrophages. The CD4 plus T helper cells that will secrete the interferon gamma, interleukin 2, toxic necrosis, tumor necrosis factor, alpha, etc. And these helps in delayed type of hypersensitivity. So coming to the oral manifestation, which is important when we see through a dentistry point of view, it occurs on that of the mucous membrane, and tongue is the most affected side. Also the other side will include the palate, the buccal mucosa, the lips, the gingiva, and the floor of the mouth. It presents as regular painful ulcers with fissures. Usually it has a hematogenous spread with diffuse involvement of maxilla and the mandible. And one of the most important technique for diagnosis is biopsy. So the tuberculin skin test. The tuberculin skin test is again divided into 4. That is the principle, the reagent, the method, and the uses. So the principle is based on delayed type of hypersensitivity or type 4 hypersensitivity reaction. The reagents will include 2 things, that is the old tuberculin reagent, and also we have the PPD, that is the purified protein derivative. And the method is like Montauk's test or the Heath test. And the uses will include measure prevalence of infection in the community and diagnose the active infection also in the children and indicate the success of the vaccination which is provided, that is the BCG vaccination. Coming to that of the laboratory diagnosis. The laboratory diagnosis will include that of the specimen. So the specimen will be like the pulmonary tuberculosis specimen, that is the sputum specimen, the laryngeal swab specimen, the bronchial castings, and also the gastric washings can be used sometimes. In the meningitis, the specimen used is CSF specimen which is collected. In renal tuberculosis, 3 consecutively early morning urine samples are used. In the bone and joint tuberculosis, the aspirated fluid which is got can be useful, and the tissue, the biopsy is done, which is one of the most important method. Coming to the direct microscopy, so how will the smear look like? So the smear is mainly made up of that of the Zeal nail set staining. As you have already discussed, it has a mycolic acid coating over it, which resists that of the staining which is done with the help of H&E stains. So they also appear as thin, slender, curved occasionally with a beaded appearance with a blue background of that of the pus cells. For large number of specimens to be seen, the fluorescent microscopy is an easier technique. Coming to the concentration method, so to see an organism appropriately, there are some concentration methods which are required. So the concentration methods can be done by homogenization of the specimen, the documentation, and the concentration. So some methods will include the Petrov method and the other method. So the Petrov method will be like sputum is mixed with equal volume of 4% NaOH and it is incubated at 37 degrees Celsius with frequent shaking for 30 minutes. Then what is done is it is centrifuged at a speed of 3000 rpm and it's done for approximately 30 minutes. The supernatant is poured off and the deposit is neutralized by adding 8% HCl. The deposit is used for smear, culture, and animal inoculation for further purposes. The other methods include by using dilute acids, mucolytic agents such as N-acetyl, L-cysteine with NaOH, pancreatins are also used for the concentration of specimen. So coming to some of the important points of this slide, The first point will include the pathogenesis, that is pulmonary or extrapulmonary, and these organisms are engulfed by the macrophages and it gets disseminated to the other organs like lung, and some of the oral manifestation will include the main target site is the tongue, and also the ulcers and fissures are common. Coming to the tuberculin skin test, we have 4 headings under it. There is the principle, the reagent, the method, and the uses. Coming to the next one, the morphology. The morphology will include, it's a slender, slightly curved bacilli with a beaded appearance with a blue background of pus cells, and it occurs as single or in pairs. Coming to the next heading, there is a lab diagnosis. First to include the specimen, that is a sputum, CSF, aspirated fluid, etc. And the direct microscopy will include that of the acid fast staining. And the last one is the concentration methods, which is done by 2 methods, that is the Petrov's method and that of the other methods. And the procedure in the Petrov's method is also an important part in this. Coming to the last page of that of the Mycobacterium tuberculosis. So some of the culture methods. The culture is very sensitive method for the detection of this tubercle bacilli, and it may detect approximately 10 to 100 bacilli per ml. So culture is inoculated in that of the LJ medium, that is the Lowenstein-Jensen medium. It is incubated at 37 degrees Celsius, and the culture examined is first after 4 days and thereafter weekly till 8 weeks. In a positive culture, the colonies appear on culture medium, and the AFB is slow growing, non-pigmented and niacin positive, and it is regarded as Mycobacterium tuberculosis. The confirmation is done by the biochemical reaction which you had seen, that is the nitrate reduction and niacin reduction, both are positive in nature. So the animal inoculation. So the animal inoculation is approximately 0.5 in 0.5 ml, that is the concentration of specimen is required, and it is inoculated into the thigh of guinea pigs, and they are weighed. So they are adjusted and the tuberculin test becomes positive, and the animals develop tuberculosis and die after a few weeks, that is approximately 6 weeks. So the autopsy, what does the autopsy shows? The autopsy shows the caseous lesion at the site of inoculation, and enlarged caseous lesion which is seen in the inguinal lymph nodes. So the tubercles may be seen in the spleen, lungs and the liver, and the kidneys are remaining unaffected. So the molecular methods, as we all see, there are some of the molecular methods by which the organism can be cultivated. So the polymerase chain reaction, that is a PCR, is one of the rapid method in diagnosis of tuberculosis, and it is based on DNA amplification procedure and has an important role in detection of the Mycobacterium tuberculosis. Coming to the serology, there are various methods known as ELISA, that is the enzyme-linked immunosorbent assay, the radioimmunoassay, and the latex agglutination test which is employed. So here we end that of the lab diagnosis. Coming to some of the prophylactic treatment, that is the BCG vaccine is given, and the vaccine is given intradermally, that is approximately 0.12 ml of this drug is given, and the BCG vaccine is given soon after the birth. A small nodule develops and it grows approximately to a length of 4.8 millimeter, and it subsides slowly. So the BCG vaccine is contraindicated in the patient of age, eczema, measles, and patient on that of the steroids. So the treatment aspects, as you have all read in pharmacology, the treatment aspect for tuberculosis is anti-tubercular drugs, which includes first line and second line drugs. The first line drugs and the second line drugs are as such, that is the rifampicin, isoniazid, streptomycin, ethambutol and ethanolamide. So there is some resistance which have been developed in India. So to treat that of the multi-drug resistance tuberculosis, that is the MDR-TB, the second line drugs with aminoglycosides or ethambutol is the drug of choice. Also, there is a therapy known as DOTS therapy, that is directly observed therapy under supervision, is being used to prevent deterioration of resistant problems by ensuring patient compliance. So this is one of the important essay question, and coming to the main point of this part. So the lab diagnosis which is continued, the culture is there in that of the Lowenstein-Jensen medium, and the animal inoculation is that of the guinea pigs. And the molecular methods will include that of the PCR, that is a polymerase chain reaction, and the serology will include enzyme-linked immunosorbent assay, that is ELISA, and the radioimmunoassay, and etc. Also, the prophylaxis will include that of the BCG vaccine, which is an important vaccine for the vaccination of that of the tuberculosis, and the treatment aspect will include that of the anti-tubercular drugs, that is rifampicin, isoniazid, ethanolamide, streptomycin and ethambutol, and that of the MDR-TB, that is multi-drug resistance tuberculosis, the second line drugs plus aminoglycosides plus ethambutol are given. And finally, the DOTS therapy, that is the direct observation therapy under supervision, is done to prevent resistance in that of the patients. So yeah, thank you. Hope you liked my class, and I request, so please do like and subscribe if you would found it useful, and also share with all your friends. This tuberculosis was an essay, and sometimes also some of this part can be asked as a short note. Thank you to one and all.